right thing. So we'll be taking you guys through population approach to disease prevention and health promotion. So this is just an overview of our presentation. We're going to cover 4 levels of disease prevention and health promotion. So prevention involves removal or reduction of risk, early diagnosis, early treatment, limitation of complication, and maximum updating treatability. So it's therefore important that we see every contact with a patient as an opportunity for health promotion. So before we go further, I would like to cover these 3 definitions. The first one is disease prevention. So these are actions that are aimed at eradicating, eliminating, or minimizing the impact of a disease and disability. So health, according to the WHO, is a state of physical, mental, and social well-being, and not merely the absence of a disease. Health promotion is a process of enabling people to increase control over and to improve their health. So there's 2 approaches to disease prevention. There's high-risk approach, which aims to bring preventative care to individuals at risk, and population approach, which is directed to the whole population, irrespective of individual risk level. And this is what the presentation is going to cover. So there are 4 levels of disease prevention: primordial, primary, secondary, and tertiary. So with primordial prevention, it aims to inhibit the development of risk factors that are known to increase risk of disease. And this is mainly achieved by health education. So childhood is a period in which primordial prevention could be effective if sustained throughout childhood and could contribute to healthy adulthood. Primary prevention of a disease is defined as actions that are taken prior to the manifestation or the onset of a disease, and this reduces the incidence of a disease. It's achieved by health promotion and specific protection. So with health promotion, it aims to reduce risk at individual and population level, and this is achieved by provision of information on behavioral risk and medical risk, nutritional and food supplementation, lifestyle and behavioral changes, as well as environmental modification. So with specific protection, it's providing vaccination and post-exposure prophylaxis of children, adults, and elderly, use of specific nutrients, for example, vitamin A in children and iron and folic supplements in pregnant women, as well as prophylaxis and control of environmental hazards. So with secondary prevention, this aims to halt the progress of a disease at its earliest stage and prevents complication. So it reduces the prevalence of a disease by shortening its duration. So this is achieved by diagnosis and prompt treatment. So we all know that patients who are diagnosed early tend to have better prognosis, and the importance of early diagnosis is to arrest or stop the disease process, to restore health, and to prevent complication, as well as improving the quality of life. So examples of secondary prevention, including providing population-based screening programs for early detection, provision of maternal and child health programs, including screening of congenital malformation, provision of chemoprophylactic agents to control risk factors. So with tertiary prevention, this seeks to reduce the impact of an established disease by eliminating or reducing disability, minimizing suffering, and maximizing potential years of quality of life. So these measures are used when the disease process has advanced its early stages. So it is achieved by disease limitation and rehabilitation. Sorry. So this is a slide that showing the progression of a disease, and the main aim of disability limitation is just to halt the transition from disease to handicap. Example of tertiary prevention, an example would be screening patients with diabetes for diabetic retinopathy to prevent progression to blindness through prompt treatment, prevention of opportunistic infections in HIV infection, following up chronically ill patients to make sure that they adhere to their medication, and rehabilitation for stroke patients to restore function through physiotherapy. So this is just a summary for the levels that we've discussed, level of disease prevention. So with health promotion and disease prevention programs often address the social determinants of health which influence modifiable risk factors. So the typical activities for health promotion include communications strategies to raise awareness, This can be done through newsletters, mass media campaigns, and public service announcement. Health education to empower behavioral change and action through increased knowledge. So you can provide courses, training, and support for patients. And making systematic changes through improved laws and regulation. So the importance of health promotion, it promotes the quality of life, reduces the pressures on the services, it's cost effective and efficient, and adds life to years. So these are just the goals for health promotion. So they give people appropriate education and information to make choices. They enable people to examine their informed choices and help people develop skill to analyze and recognize alternative choices, and empowering people to be able to make informed decisions about their health. So that's it from us. Let's just remember that prevention is better than cure, and every contact with a patient is an opportunity for health promotion. Thank you. I think that's the end.
All right, thank you very much. I think, last but not least, I think the problem is that health promotion tends to be seen as a nice to have, and usually it's the health system and the payment system specifically that does not support that. If there is going to be a good health system, it needs to be able to include health promotion as a part of the payment system, and that only works with capitation models. If you're paid on a fee-for-service basis, you'll never get to health promotion. It's very difficult to capture health promotion and prevention activities very easily. So just keep that in mind and know that when you are seeing newer payment systems, think carefully about how you get paid specifically for health promotion. All right, thank you all very much. We finished 2 minutes before the end, and apologize for the rush and getting 5 presentations into the 2 hours, and for those who had to curtail their presentations. Thank you all also for the feedback. This is going to be our last opportunity to chat. It's been great to see all of you being part of this learning. We have, I think, we always appreciate interns. You guys have done an amazing piece of work. I think you realize quite frequently that it is not a very functional place in primary care. We have a lot of challenges with doctors who are not exactly doing what we want them to do. And that's why when we got the feedback, with the supervision, it's been somewhat challenged in some places. We hope to get more individualized feedback as you're going along and improve it for the next block. But on behalf of all the people of Johannesburg and the managers and all the family physicians in the Department of Family Medicine, I want to say to all of you, thank you very much. We really appreciate every little bit of inconvenience and difficulty of experience, and wish you the best in the future, your career, and hope that you'll come back sometime and work in primary care, and that you'll help shape it for the better in the future. Take care, everyone. Best of luck with your careers in the future. It's been great knowing you all.